I didn't have that on my calendar, right? But I don't care. But anyway, we're gonna stop right now and clarify some things. So if you'll just pay attention here for a few minutes. You guys have done a good job at bringing up some points that we need to clarify. So now that you've experienced at least some of the modalities, let's go through a few extra little tips and then I'll entertain questions. So first of all, when you do the cryo cuff, I neglected to point out that you need to open the valve on the top to make the water go in. I think most of you figured that out. But make sure you do open that little valve at the top. When you put whatever appliance you're using with the cryo cuff on the patient, you don't need to cinch it down really, really tightly with the Velcro. You just need to get it on the extremity because the compression comes from the water that's in the appliance. If you strap it down too much, there are times when you could impede the flow of water into the appliance. So don't do that. Just get it on the person comfortably, and then it's when the water goes in that you get the compression. Okay? On the cryo cuff and also on the cold pack, your goal is not to get the patient numb. If you have somebody who's really sensitive to cold, they may get numb, but that is not your goal. Numbness is your goal when you're doing an ice massage, but it is not your goal for a cold pack or a cryo cuff. So when you do a competency or a lab practical, if you tell the patient they're going to feel numb from this cold pack, then we're going to mark you off because that is just not right. Would you agree that you did not get numb with the cold pack? Cryo cuff, some people feel a little bit numb, but that is not your goal. Your goal is pain control and edema control. So what do you think you could do if the cryo cuff is either too tight or too cold? And how would you do that? That's the correct answer, but how?
Drain some of the water out.
Drain some of the water out. Good thinking. Okay, so if it's too tight, or even too cold, sometimes draining the water out will help. You can put a pad of something, a cloth or something in there, but again, when you have compression, it's kind of the same principle of bandaging. You have to be really careful because you're squeezing an extra something against the skin, and so there's a little bit of danger of damaging the skin with that. With the polar pack, which side goes against the patient? The soft side or the shiny side? The soft side, right. And so you want to look at that. I think all of our polar packs that we have here in this lab are designed for a knee. So they have kind of a cutout place for the patella, and then they're designed so they can wrap around the joint, distal and proximal to the knee. And so you can affix that with a strap. Some of the newer polar packs actually have some Velcro on them. The most recent one I saw actually had a little pad that went in underneath it, so you weren't right against the pack itself. It was a nice thin kind of a shiny kind of fabric that was probably waterproof. That was very, very nice. That just laid in under the pack. If you're using the polar pack in the clinic, which you might, we don't a lot, but you might. But if you're in a clinic that's using a polar pack, then you definitely want to have something on the side that's touching the patient for infection control. So a cloth, a pillowcase, something, so that paper towel, so that is not right against the patient's skin. And polar packs are used for extremities, knees, elbows. Is there a shoulder polar pack?
Yes.
Yeah, but not generally backs and necks. So when you see a polar pack, you're generally going to be working with an extremity. Dr. Brand, anything else on polar pack or cryo cuff?